Hello, conference attendees. My name is Ajit Johal. I'm a pharmacist and vaccine educator in the Vancouver area. My presentation today is called 15 Minutes Could Save Your Life. So my presentation is a 15-minute story where I'm going to hopefully give you some valuable information about influenza disease and vaccination, which could perhaps help save the life of a family member, friend, or one of your patients. Thank you for all that you do and for being a valuable member of the healthcare team. So let me begin with the story. With 15 minutes on the clock, we start with a lesson in history. Life expectancy at birth continues to climb. When in the 1840s, nobody was living past the age of 40, till now into the year 2020, where life expectancy has almost doubled. How has this happened? Well, for the first time, the world is starting to have more older individuals than children. And we're starting to see an aging phenomenon that we're going to be unprepared for. Unless we create a society and an environment where older individuals are respected and valued, we're not going to be able to handle what's in store for us. The BC seniors population is continuing to grow, especially in British Columbia, where many Canadians, especially when they retire, want to come out here and avoid the cold winters out east. You can see the distribution is becoming almost 25% of adults over the age of 65. Aging population is going to continue across the country, with in 2036, it's expected to double to about 10 million individuals over the age of 65. What do older adults value the most? So there's some good data from Statistics Canada that older adults, what they really value is their health and independence. Currently, they are just as active, if not more so, than those lazy millennials, continuing to do household chores, hobbies, but ultimately maintain their relationships and an active lifestyle. Older adults are maintaining their independence more than ever, and it's something that they value most. This can change very quickly with an infectious disease like influenza. Despite being a very small virus, less than 80 nanoparticles in diameter, it can change the picture very rapidly. In fact, it can take away that very independence that older adults value so very much. That brings us to chapter 2, influenza, the burden of disease. Older adults suffer disproportionately from influenza, with 70% of hospitalizations and over 90% of influenza-related death happening to this demographic. Why does this happen? Well, it's a phenomenon called immunosenescence. As we age, our immune system ages with us. Pictured here is UK marathon runner John Starbrook. And he is an incredible athlete. At the age of 70, he is running marathons. Something that most of us do not or cannot do. But despite the fact that Mr. Starbrook and some other people in his age demographic are competing the greatest physical health testament that we can think of, we look at a trend in times. So when we look at the times in the New York City Marathon, we start to see an important trend where even as we get older into the age category, starting from 20 to 24, all the way to age 65 to 70, the times increase. And even though older adults are still finishing the race and competing, and it's excellent, it just takes a little longer. And that's kind of how we describe immunosenescence. As we age, our immune system ages with us. Doesn't matter how we look or how we maintain our lifestyle, the immune system declines, makes us more susceptible to disease and its complications, and as we'll see later, less responsive to vaccination. Did you know that older adults over the age of 65 are 5 times more likely to die from influenza if they have a chronic heart condition, 12 times more likely if they have a chronic lung condition, and 20 times more likely if they have both? How does influenza cause heart attack and stroke? Well, you may not be aware of the fact that in the first few days of an influenza infection, the risk of heart attack and stroke is 6 times higher. And that's because there's this massive inflammatory response where the body tries to fight it off, but unfortunately dislodges plaques in the arteries and causes them to travel to the heart and to the brain, causing heart attack and stroke. This has been proven in clinical data, where in Public Health Ontario, where they took a look at what the statistics were. And unfortunately, flu infection increases the risk of heart attack, particularly in the first 7 days, by 6 times. And it doesn't just end there. So even if older individuals survive a bout of influenza, they can turn out to lose their ability to do that health and independence and lose their ability to perform those activities of daily living that they value most. So picture here is a powerful juxtaposition, picturing an individual putting on their shoes, going for a run, perhaps a marathon race, and the same individual stepping gingerly out of a hospital bed into slippers. Becoming bedridden with influenza, which is something all too common for older adults, causes them to lose muscle mass, lose strength. And even after the infection, there's this slow burn of inflammation that basically makes them unable to perform things at the same level that they used to. And this is everything for older adults. So if this can be prevented, why not get the influenza vaccination? So with 10 minutes on the clock, are all influenza vaccines created equal? Is getting the flu shot enough, or is there actually a better one for those over the age of 65? Well, you may not have been aware, there's actually 10 different influenza vaccines authorized for use in Canada. And when we look at sort of the top bracket here, the publicly funded supply, that's typically what's available for most people in the publicly funded program. We're starting to see more and more use of something called the high dose vaccine, which basically contains 4 times the amount or dose as the regular influenza vaccine to provide a better immune response and therefore better protection for those over the age of 65. For those who have friends, relatives, parents, or patients over the age of 65, Chapter 3 is what is the best vaccine for them. So of the vaccines available, most of them are free for adults over the age of 65. So that's the one that's typically called the standard dose. But it's recommended by the National Advisory Committee on Immunizations for influenza vaccinations that for those over the age of 65, given the burden of influenza disease and the good evidence of better protection of the high dose vaccine, those over the age of 65 should get the high dose vaccine. It is the NACI preferred option, and what it does, it contains 4 times the amount of antigen for the immune system to work with to provide a better immune response and to combat this gap that we see with immunosenescence. We look at the top gray line. This is individuals 15 to 64. That's how they respond to the vaccine. Below that, you'll see this massive discrepancy between how those over the age of 65 respond to the vaccine. How do we make up that gap? Provide more antigen, provide a better vaccine. So now it brings us back. We can't talk about influenza without talking about COVID-19. And when we look around the world, even though a vaccine is available for COVID-19, we're still seeing infection in those who are vulnerable. So we look at Israel, who started their vaccination program first. They're seeing a dramatic case in COVID-19 cases in August. And here's why. When we look at the clinical trial, so this is the massive 40,000 person trial that was used to approve the vaccine, making it safe and effective for use in the population. Most of those enrolled in the trial, 80+%, were under the age of 65. Only 20% were over the age of 65. And what does that mean? Well, we immunize those over the age of 65 first. Naturally, we would see a decline in their immune response because of immunosenescence. So even though we haven't approved boosters at the time of this recording, and hopefully by the time of the conference, this information will still hold, but we still need to recognize the fact that older adults don't respond as well to vaccines, standard dose vaccines, and are more susceptible to disease. So this fall, if there's no booster available for a friend, relative, patient over the age of 65, encourage the high dose vaccination because it is backed by tremendous amounts of data, randomized controlled trials showing that it does provide better protection in the form of hospitalizations, functional decline, death, and even influenza infection than the standard dose. What is the Canadian government doing in terms of funding? Well, many provinces and territories have funded it for all adults over the age of 65. Ontario has done it, Alberta has done it, and Prince Edward Island is doing it as well. When we look at British Columbia, it is available, publicly funded, free of charge for adults over 65 in long-term care facilities. It's also available for those in assisted living and those living in First Nations communities. We're seeing an expansion of this program, but still no vaccine for independent community dwelling seniors. They still have access to it, but they do have to pay for it. And this is reflective of a lot of our immunization programs. This is a blurry list of all the vaccines that are recommended across the lifespan. This large circle is for all those under the age of 65. This small circle is for those over the age of 65. So we still can do some more work to provide better vaccine coverage, but at the same time, there's still value to protect yourself at the individual level. So with 5 minutes on the clock, what can you do for your friends, relatives, or patients over the age of 65 to protect them at the individual level? So where do we go from here in BC in Chapter 4? BC independent seniors are faced with a choice: publicly funded standard dose vaccine or private pay high dose QIV vaccine. Approved but non-funded vaccines. Now, just because a vaccine is not covered by the government and is not free doesn't mean it doesn't have value. So why is it that some vaccines are covered and some aren't? At the end of the day, we have to look at, for individuals, if they want better protection, they have the prerogative and the access to know about it and to access it. So even though at a population level, there's an expense that perhaps doesn't want to be paid, but slowly it is being paid, individuals still have the benefit to access the therapy, and vaccines are no different than any other therapy that falls into this category. And why is this valuable? Well, when we look at something as simple as influenza vaccination compared to lifelong interventions like smoking cessation, taking your medications for blood pressure or cholesterol, it's got a tremendous effectiveness in preventing heart attacks. What's the difference between influenza vaccination and these other lifelong interventions, which are all important? Well, influenza vaccination is the only one that takes 15 minutes. So 15 minutes could save your life. Where does the situation look like for high dose this season? So the high dose flu vaccine was talked about in this presentation, but unfortunately access to it has not been great. In 2019, there was a 2-month delay and limited funding, which led to lots of uproar with individuals commenting saying, way to go, BC, by not paying for it, you're just putting a bigger strain on the hospitals this flu season. It will cost a lot more money in the long run. Canada's long-term care facilities have been the majority of COVID-19 deaths have occurred in these demographics, especially since the start of the pandemic. Influenza also hits these demographics particularly hard. So that's why we need whatever tool we can to reduce the curve against both COVID-19 with vaccination, but also with enhanced influenza options. Every tool at our disposal is a way out of this pandemic. So this influenza season, if you know someone who's over 65, recommend the high dose vaccine for better protection. This was the start of the pandemic where we wanted to avoid, this is back from February of 2020, so they wanted to delay it beyond the fall influenza season to give officials time to prepare. And it's the same thing. We don't want to have influenza and COVID-19 straining our system. Even though last season was a low burden influenza season, things like social distancing, public health measures, all kept it a low season. But as we start to reopen, move back to pre-pandemic levels of interaction, activities, we want to make sure flu doesn't come back. One dot does not make a line. Just a one low burden season does not mean influenza's gone for good. Continue to vaccinate yourself, your loved ones against influenza, and if they're over 65, talk about high dose or enhanced options. Even though we have a COVID-19 vaccine available, it doesn't mean things will end abruptly. It's not like flicking a switch. It's a dimming switch where we need to use every tool at our disposal for vaccination to get as many people vaccinated so we can move forward. Vaccines do work, but they do take time. So we look at all these diseases that we saw many cases and many deaths years ago. Now we see some of them have been eradicated, and hopefully, perhaps COVID-19 can be one of them. How you do anything is how you do everything. So when you recommend vaccinations, you address concerns, when you talk to your patients, remember the importance of vaccination and also for enhanced vaccinations for those who are at highest risk. With the last 2 minutes on the clock, I encourage you to take a look at a video called Seniors in Influenza, Worse Than You Think. You may recognize some of the actors in that video. In terms of where can I get it or where can I find the high dose vaccine, the BC Centre of Disease Control says with specific knowledge of a patient's risk factors for severe illness due to influenza, which is pretty much everyone over the age of 65, providers can inform clients of the availability of the high dose QIV vaccine. The vaccine will be available for purchase through select pharmacies and travel clinics throughout BC. So if you want to provide access or recommend access, do check with certain pharmacies because some of them will have it in stock this coming flu season. If you're interested in this presentation slideshow, you can download it on my website, immunize.io. Thank you so much for listening to this presentation, and I hope you enjoy the rest of the conference. Take care.